If you're having implant-based breast reconstruction, you really need to have a conversation with your plastic surgeon about breast implant illness. It's one of these concepts on the internet that really just has such polarizing views. But as a surgeon scientist, I like to stick to the data. So let's talk about what the data actually suggests. The data suggests that some women do have symptoms that they believe are coming from their implants. There are prospective studies looking at what could be predictive factors of who's going to feel better when they have implants out, or even before that, who's going to develop symptoms if they have implants placed. And what most of the studies have shown is that there aren't predictive factors on either end. The challenge with that is that if I then have a woman come into clinic who believes her systemic symptoms are coming from her implant, I can't tell her with any degree of certainty as to whether or not she's going to feel better if her implants are out. Importantly, breast implant illness has been shown in women with saline and silicone implants for reconstructive and cosmetic purposes above the muscle and below the muscle. So it's really challenging to once again predict who's going to develop symptoms and who's going to feel better. But there is one thing that the research continually shows, and this is where surgeons are taking advantage of women. The research clearly shows that to get a response, meaning feeling better after your implants are removed, if you're one of those women who is going to feel better, it does not matter if you remove the capsule. Remember, the capsule is that scar tissue that has formed around the implant. Why this matters is that the location of your implant can make the capsule potentially dangerous to remove. If your implant is above the muscle, if I take out the back layer of the capsule, it's on top of muscle, so that's a safe plane for me to be in as a surgeon. If the capsule is on top of the ribs because your implant is under the muscle, what's under the ribs? The lung. So there are reports of people getting their lungs damaged because a surgeon tries to remove the entire capsule. Now, sometimes we have to remove the entire capsule. For example, if we are treating ALCL, which is the lymphoma that has been related to implants, I have to remove the capsule. So then I will remove the capsule, every last piece of it, because that's the oncologic treatment for that disease. But if you are having implants for reconstructive or cosmetic purposes, this is something that your plastic surgeon should bring up. And if you feel like your symptoms are coming from your implants, that's also a conversation that you should have with a plastic surgeon, and you should not feel dismissed. You should have an honest discussion of what the data does and doesn't present so that you can make a good plan for yourself.